everyone. Welcome to the Solh Talk. Today we have Ms. Kiran Makhijani with us on World Health Day. Ms. Makhijani is a psychologist, counselor, and a psychotherapist and has been awarded the Health Icon Awards 2021. We welcome you, ma'am. As we all know that on this World Health Day, physical health is very essential and very important. But the most important, I think, is the mental health issues that we all are facing and we have been going through since the COVID time. So we wanted to speak to you on how to bridge the gap for availability of mental health services.
Firstly, thank you for having me here. It's great pleasure to be in a conversation with you on such a wonderful day.
Same here, ma'am. So, ma'am, as we all know that India still lacks a lot of mental health professional ratio. So there was this data which has been there with WHO, which says that India has 0.75 psychiatrists per 1 lakh people. So what do you think are the major reasons for this gap?
In my experience and in my knowledge, one of the major things that I have seen is that there is a lack of infrastructure in terms of how training is done overall at a national level. But if you actually look down even a little more deeper, you will see that a lot of the states in itself would have these, the programs in most of the metro cities.
Right.
Which also makes a huge difference, and it impacts how many people would then get enrolled into the program, specialize in psychiatry, and that's how it goes. That's one of the major reasons that I have been observing in all these years, which is the case whether it's you're in the field of psychiatry or even if you are a psychologist. There are a lot of infrastructure, limited facilities as students that we have. So
True.
That's a major thing that I see.
Yes, I completely agree with you, ma'am. I think with the major infrastructure issues, I think the resources and the lack of awareness, I think this is the main reason for a gap between the psychiatrists and the common people. And ma'am, what do you think? What is the main reason for the lack of mental health services and the treatment gap? We have seen that people not going to the psychologist or the psychiatrist for the treatment, or they refrain going to any of the clinics. So, what do you think is the major reason for this?
One is definitely awareness. There's a lack of awareness about mental health. Of course, over the pandemic, the awareness has definitely come up. It has increased. A lot more people have started reaching out because they started seeing people around them experiencing similar concerns. But in spite of the increasing awareness, there's a lot of stigma that is associated. How can you go to a psychiatrist? How can you go to a psychologist? Tum pagal thodi na ho, kind of a approach that is there. So the stigma associated definitely plays a huge role. Though there are a lot of advocates, a lot of people who have now started understanding that it is equally important just as physical health. So just as simply as you would consult a physician, you can also consult a psychologist, a psychiatrist for your mental health concerns. It's not always only about going into, getting admitted or doing you can do a very specific kind of intervention. It depends, of course, on the concerns that you have.
Absolutely.
But that awareness is something that we need.
Right. Very well said, ma'am. Because we have generally seen that, as you just mentioned, that there are many advocates who are actually fighting for mental health system, creating awareness, working on it. But ma'am, do you think the government is actually taking any initiative, and how can we, try to support the local government or the national government in creating a service so that we can promote mental health?
There are a lot of policies that have now recently started coming in. So, just creating awareness and we talking about it to our patients itself, and doing a lot of awareness programs in relation to how the government is really supporting mental health would be a great step. And of course, the affordability and keeping in mind how the costs should be varied based on the economic strata that a person comes in.
True, true.
That is also important, because there are a lot of people who refrain from mental health services only because of the way the costs are set for mental health, and they find it pointless then, that why are we paying so much, even though they would do it for a physical health concern. So there's a balance that we would need to get
put
over
in.
there.
Yes, yes, absolutely, ma'am. I think there should be they should maintain a systematic way where there should be, proper guidelines which has to be there, and a proper infrastructure. Then as you said, the financial issues also comes in. So I think everything has to be taken care
The
of.
insurance policies that have been set in relation to mental health, that should be highlighted so people know that they can reach out, and they can also make use of these policies that the government is now trying to highlight too.
Right, right. Absolutely. Well said, ma'am. So, ma'am, we know that, as you just said, there are certain barriers also that is being put in healthcare services. So, and what are those barriers, ma'am, and why individual does not try to come and seek help?
Again, the system that we in ourselves would create in within the healthcare sector, with relation to mental health, again, it's a very specific area that we look at. It already has a lot of stigma associated. It's not as simple as going to a physician or a dentist. So creating a simplified way in which a person can reach out for mental health services, letting them know how, if there are, definitely we would have to be careful on certain aspects if a person is self-harming or is too aggressive. But people shy away with that reason also, that if at all my confidentiality will be breached, then what? So the way it is communicated to them, and the way we explain how the whole system would work, it's like how you explain a surgery. If we can explain just how simple and effective the service can be, that is definitely something that we can do as professionals in the field.
Right. Completely agreed, ma'am. But ma'am, coming to you with your personal experience, as you said, you're a psychologist and you deal with various people. You come across different people from different sects of the society. And what are the real struggles or the real challenges that you face in and around the mental health system?
A lot of it is to do with no willingness to open up. There's a lot of resistance. Like someone could just consult because the person is being pressurized by a person who understands what mental health is, but I don't find it effective enough. So breaking through that resistance is one barrier that we see. So that you can help the person, given that the person actually is open to the idea of undergoing counseling or any pharmacological intervention. That's one. Then there's the vice versa of it, where I am open to it, but people around me are not open to it.
Okay, acha. Okay.
So when I am open and people are not open, then it's like, I know I need the help. I am doing better. There are a lot of people who have come up to me and said that we are feeling, even if it goes as severe as self-harm and the whole aggressiveness part of it, but we know that our family members will not support it. What can we do in such a situation?
Right.
So that's another barrier that is there. Mm-hmm. I am up for it. My family is not up for it. My family is up for it, but I am not up for it, because there's a lot of, again, stigma that is associated to that. So that's a major barrier that does come in.
Right. But there would have been certain times, when you also wanted to just give up, like, no, because the person is like very, not the person, I think the system is so reluctant that they do not just want to open up. So were there any time that you just wanted to give up? You were like, I'm not supposed to do this. I'll not do this.
Initially, in the initial years, when you're just getting into the field, till the time you can get that confidence that you can deal with a lot of situations, it does pass your mind. Of course, we are not we don't come with a manual even when we are training as psychologists. But of course, at those moments I have looked back at my seniors and, help go one step further in the situation, equip myself. So every problem has a solution, like how we would say. So
Absolutely agreed, ma'am. So, ma'am, as we knew, so during this COVID time, there were many initiatives that had taken place with the help of the government of India and by the local bodies. So, ma'am, what are the initiatives that are being taken place by mental health professionals or the therapists to provide the mental health system or the ecosystem in India or globally?
so what there were a lot of groups, there were a lot of helplines that was set up by the psychological societies, the psychiatric societies. BPA had set up its own helpline, and a lot of us reached out via those helplines. We provided free counseling, free assistance, of course, wherever required, to go beyond just a telephonic conversation. The people having concerns were informed, family members were informed. That was one thing. Offering pro bono services was another thing at an individual level that almost every psychologist and psychiatrist must have done at some point during the pandemic. There was no going back on that, because mental health was really the need of the hour during the pandemic. uh, that's another thing. Even now, a lot of us do offer a certain amount of our services pro bono, along with ensuring that we can give them the best what they need in mental in terms of their mental health. So that those were few things, and of course, doing our awareness sessions, passing out messages as to how they can deal with certain common concerns that everybody could be facing. That is another thing that everybody engaged in.
Okay, ma'am. And ma'am, so any examples of the current, the mental health programs or any system that is being run at present that you can just enlighten our audience with?
All the government helplines are still functioning, and of course, if you reach out to any mental health professional, you are certainly going to get a lead in case if you need any subsidized service, or you just need to reach out. Also, all of us are just there are multiple directories that have been formed with all the information of all the therapists, psychiatrists, everybody who are the mental health social workers. Everybody, those directories have been created. They are all over the internet, so you can reach out to anyone, and you will definitely get a lead. That's for sure.
True, absolutely true, ma'am. So, ma'am, there's another research that had happened, and we just read about it, where it was shown that people who are actually staying in the countryside, the rural areas, had more of stigmas and stereotypes being attached to them as compared with the people in the urban areas. So generally, we have seen that the government is taking, they're reaching out to those people in the rural areas and taking some initiative or some other initiative, but somehow it had not reached to those people. So, what do you think were the major reasons for not going there, or the major hindrance that was there?
One, definitely the kind of services they receive in rural areas is a major reason, right? The availability that they would have to electronic media, and that's one thing where we have been doing maximum amount of awareness using our electronic media. Not, you couldn't reach out physically during the pandemic, and again, the thinking pattern that everybody has, that we can't talk to someone, हम लोग अपना दुख कैसे बांट सकते, they don't do it within their own families. Right. So they going out and reaching out to a total stranger will be another challenge in itself for them. So
right. Yeah, it's a very sad state to see, people not reaching out when they have the resources and so much awareness that is being going on right now. It is very sad. So, ma'am, on this World Health Day, what strategies will you plan for a comprehensive approach to mental health system and social care needs, which can inform intervention, services, support, and advocacy? What will be your viewpoints on this?
I personally would definitely suggest, or I also do this. We do a lot of group sessions where people with mental health concerns and people who are not per se experiencing mental health concerns can also come in. It's just that you talk, just creating that whole atmosphere of, yeah, we can talk. That is something that really would be beneficial. It's not that you need to go onto a severe level of a mental health condition.
Yeah.
You can just share your daily stressors also. That in itself also creates great coping strategies for you. The ones around you would get inspired, motivated. For all you know, that all would be happening.
Right.
And so that's one thing that definitely could happen, creating an atmosphere to speak.
Right. And how can this atmosphere be created, ma'am? Like with the help of, how can you do that?
uh, Hospitals can definitely join in. So the hospitals could create such, events, such programs for all visiting the hospital. So reaching out to them, if being, it can be a complete voluntary thing, there's no compulsion to it, but if they want to reach out, they can definitely reach out, giving them constant updates about these events. That's something that can happen on a large scale. Like everybody at some point would visit a hospital.
True.
For that matter, even our pathology labs, the diagnostic centers can also contribute to this by again creating the same awareness that these events do happen.
Okay.
So that's one thing that definitely could be a part. And of course, as mental health professionals, we can also reach out and put it on electronic media, print media.
I think a lot of being is done right now on social medias also, where a lot
Exactly.
of mental health pages have services are available. There are so many organizations, as you said, support systems, support care groups have come up, support groups have come up. With the, when you see, in the college, at the college level, at an institutional level, at a corporate level, a lot of mental health advocacy and awareness is being created. So, and
Absolutely.
yes, ma'am. So, what would be your message to our audience?
If you feel the need to talk, do reach out. We are all there.
Right.
We reach out. So even we reach out when we have to reach out. So even you can. That's definitely something that I would say.
Yes, yes. Okay, ma'am. And thank you, ma'am. Thank you for being here, for being a part of our show and sharing your valuable insight. Any thoughts or suggestions, any thoughts you just want to put in to about how was this chat show? Did you like it? How was your experience here?
Absolutely. I definitely enjoyed it. Thanks for inviting me. It was great having this conversation. And I hope someone somewhere listens to us and does take the step to move their mental health further.
True, ma'am. We look forward having you again with us. Thank
We
you,
look
ma'am.
forward.